Well, New York City seems to be the center of the current monkeypox outbreak. Cases actually in the city continue to be mounting. Getting the monkeypox vaccine also has been so difficult, but health officials say more doses are on the way.
Joining us this morning from Long Island City, New York City Health Commissioner Dr. Ashwin Vasan. Nice to have you back on Good Day New York.
Good to see you.
All right, so give us the numbers on how many people have monkeypox right now, and will there be enough monkeypox vaccine?
So currently, there are 336 known positive cases here in New York City. That's over 30% of the cases in the entire United States. But I want to be clear to people, we are not doing enough testing as a country because it's taken us time to get an approved clinical test so that a doctor can just send quickly a clinical test to get a result. So until we really start ramping up testing, we're not going to really know what that true burden of disease is. And so I'm very encouraged that there are at least 2 commercial labs that have come online in the last week, and a few more to come that are going to start doing more clinical testing. That'll help us a lot in public health to get our arms around this pandemic.
So, Doctor, I'm just confused. So is there not enough testing because you can't get the tests, or people just aren't being tested? Because we know right now it's difficult to get the vaccine. And in fact, people are frustrated. They can't get an appointment. It's almost like COVID 2020.
Yeah, I understand those emotions and I understand that feeling. Look, monkeypox was not a disease that we kept a lot of stock of testing or vaccines for. We actually thought of it more like a bioterrorism thing. And as soon as it started to come to our shores, we had to ramp up that system. So we're ramping up clinical testing. The federal government is. The federal government's also trying to get us more vaccine. We have 14,500 vaccines that were more doses coming in now to go to New Yorkers, and we'll be making announcements shortly about how we're going to distribute that. We've had about 20,000 doses come in since the beginning of this, and we've distributed those. And so, we're working to get more and more out there. It's obviously dependent on how quickly the feds can get that vaccine into the country.
So when will you make that announcement about how you can get a vaccine? Because I think that has been a source of frustration for so many people.
Yeah, and we totally understand that frustration. Whenever you've got something that's scarce and not enough of it, there's going to be a lot of demand. And as you're seeing, there's tons of demand for this. Appointments are snapped up in 10 minutes as soon as they go online. The website crashed the other day because of volume of traffic. And so we know that there's overwhelming demand. We'll be making announcements in the coming hours and days about exactly how we're going to get those doses out to people. And we're working every day behind the scenes with our federal partners to get more. We're advocating for New York City. We represent 30% of the cases in the country. We need to be getting a proportional share of the vaccines coming into the country to attack this.
Dr. Vasan, we love getting our viewers' questions involved in the conversation. One good one that I found was someone asking, can you get monkeypox from shaking the hand of an infected person? Is it transmissible from touching a surface? What about saliva, or if someone sneezes around you?
Yeah, these are all good questions. First and foremost, monkeypox is not highly transmissible in the way that something like COVID is, or a more transmissible infectious disease. It requires close and prolonged skin-to-skin contact with an infected person, and usually an infected person with lesions, active monkeypox sores, or pustules, as we call them. And so the question about shaking hands, it's unlikely that if you shake someone's hand that you're going to get monkeypox, because that's not prolonged contact. You can also pass it through prolonged face-to-face contact with someone. So that's why we're focused a lot on intimate behavior, sexual activity, because those are prolonged contacts. Now, there is evidence that you can spread monkeypox on bed sheets and linens and clothing of someone with monkeypox who has open sores. And so that's why some of the guidance is also about washing bedding, washing clothes, if you know you have monkeypox or you think you've been with someone who you think might have monkeypox.
All right. Thank you for answering those. I know a lot of people still have questions about that, and the information's not as upfront as we probably like it to be, but you're doing a great job with that. Want to ask you about COVID. We're seeing the uptick in cases right now. You kind of said something before the break, which was interesting. You said you are still a little bit hesitant about calling it a sixth wave. Why is that?
Well, there is high transmission in the community, so there's no doubt about that. BA4 and BA5, the current variants, are driving a lot of transmission, and we don't have a lot of restrictions in place, and people are moving about the city and trying to get back to their lives. So on some level, you know, this is something we have to deal with, and our recommendations to New Yorkers are the same. If you're going indoors, wear a high-grade mask. If you haven't been boosted, do that now. There's never been a better time to do that. Get tested frequently. We've just announced we've distributed 35 million at-home tests, and there's plenty of on-site clinical testing as well available to people. And now we have treatments, right? We have treatments that are available through your provider, treatments available through our COVID hotline, and treatments available through our mobile test to treat program, which is the first in the country. And so we have all of these approaches to keep us safe as we try to get on with our lives. We're reassessing the way in which we communicate about this because, let's be frank, a case of COVID for most New Yorkers is not the same in July 2022 as it was in March 2020 or even January 2022 during Omicron. And so we need to be clear about what the data is actually telling us in terms of impact, hospitalization, severity of illness, which thankfully is actually much less than it has been in prior accelerations. So that's really where we are, and that's why we took down that risk alert system and why we're reevaluating the data and how we communicate to New Yorkers about what's best. But to individuals, wear a mask, get boosted, get tested frequently, and get treated when you test positive.
So, Doctor, before we go, I just have a question for you. Yesterday, I noticed Mayor Adams was doing press conferences fully masked. He just had COVID in April. Does he need to take those kind of precautions? I mean, where's the antibodies? Where's the herd immunity? Like, do we need to be that
take those precautions, right? I mean, getting infected with COVID isn't certain that gives you any long-lasting protection. We think that getting infected maybe gives you about 90 days of protection, and it's not as strong as getting vaccinated. So the kind of protection you get from vaccination is far stronger than the unpredictable level of protection you get from being infected, right? So I would not want to play a game of chance here saying, I got infected, so I don't have to worry about it. That isn't the message to New Yorkers. It's get vaccinated, because that's guaranteed protection. But what we are seeing in these new variants is that they are beginning to, escape our vaccines as our immunity wanes, which is why boosters are becoming really necessary. Go get your booster if you haven't been boosted. We really want to see those numbers rise, especially as we enter into the fall and as we see these variants take over here in the city and in the country.
Appreciate it, Dr. Ashwin Vasan. Thank you so much for coming on and clarifying things for us. We appreciate it.
Certainly do.
Of course, anytime.